Hi, Pat.
Hi, Ron.
We're not getting Angie today.
We're not, or maybe I wonder if she's just not. She was going to be here though.
Yeah, no, Christina just put a message out saying she wasn't going to be here.
Oh,
Conflict.
oh, okay. I'm always just hoping she's not feeling bad.
Yeah.
I thought we moved it to 2:30 so she wouldn't have a conflict.
Yeah, maybe whatever the other one was changed, huh?
Yeah, she had an additional meeting. I think it was for River Bluff.
Okay.
Okay.
Well,
Lucy.
we're okay with 3, aren't we?
Yeah, we got a quorum.
Good.
Okay.
I don't know. Is Bob out or in, or do you know, Christina? Don't know. Okay. We'll wait our 2 minutes and see. And
Okay.
hopefully Sandra's joining, and
Charlotte will be joining. Dr. Martel will join a little later. And it looks like it said Bob McCreath was joining, but I don't see him on here yet.
Well,
We just have to wait for Charlotte, but we definitely have a quorum.
Okay. I'm going to go get a coaster for my iced tea glass. It's dripping in my lap.
Lucy Hoover, the
Yes.
master of the appeal process.
Yeah. Well, you'll never know. With the way everything is now, we might get appeals where we really haven't run into this.
You know, we haven't had an appeal. The only
Okay.
appeals I remember were disciplinary.
Exactly. Yeah.
And it's been a long time.
Oh, I know.
Oh.
Here comes Charlotte. Hi, Charlotte.
Hi, Ron. How are you?
Good. I really enjoy not having to share you with the state's attorney. He was getting annoying.
I can say it's much less stressful for me too, so I'm enjoying it.
Yeah, I can imagine it's got to be less stressful.
Yeah. Actually get to focus on, projects and
Right.
it's a good thing. So
So,
I don't know if you heard, but Dr. Martell's in another meeting, so she may be running a little late. She said to get started without her.
Okay.
and
Once you're
Bob
ready.
said, just real quick, Bob said that, well, he actually joined the BOH meeting for tomorrow. Why, I don't know. So I just sent him the link for today, so he should be joining shortly. But you can start, Charlotte.
Well,
Well-
whenever Ron's ready, he's the chair.
It's 2:30. Let's get started. So we'll start the policy committee meeting for September 20th. And we need approval of the agenda or disapproval of the agenda.
I will move approval.
Second,
Any changes needed? No.
I don't think so.
All right. All those in favor?
Aye.
aye.
Opposed? That would have to be me if there was a opposition vote. Gee. Okay, so approval of the minutes from September 15th.
So moved.
Yep, second. They looked okay to me.
Okay, good. All those in favor of approval of the minutes?
Aye.
Aye.
Opposed? And we've got Bob.
Good
Good.
afternoon.
Hi, Bob.
Hello,
Hey,
hello.
Bob.
Hello, hello.
All right, so we have two personnel policies still floating around that we made some, we asked for some changes to. The first one is the vaccination policy for employees, interns, students, volunteers, contractors, FedEx employees, Grubhub delivery, DoorDash. and-
Okay. Careful, Ron. We didn't go that far.
Oh, okay, I'm sorry.
Yeah,
Go ahead.
I like this whole draft. The changes that were made make so much sense to me. But then my last minute question was, what's the difference between an employee and leadership? It says Winnebago County leadership and Winnebago County employees.
Would it be that leadership is exempt from overtime, whereas employees are non-exempt?
Leadership are just the center directors primarily, and we only put that in specifically because we wanted them to be vaccinated first.
Okay,
And then, I mean, they're still employees, obviously, of the health department, but setting the example.
that's what I thought. So I just was a little bit
Yeah.
wondering about that, but I
Yeah.
really.
I thought it was leadership team, the usual suspects.
Mhm.
Mhm. And I don't know if you noticed, I made some additional changes that I
Yes.
caught as I was going through it.
Mhm.
And I'm gonna make one more change with your okay. I think I left in, on the influenza, a couple spots that if they declined the vaccination, then that's not an option anymore. It's only if they're exempt. So there's a couple spots I have to change declined to being exempt.
Oh, okay. So in the past, they would say, no, we don't want the flu shot, but then have to wear a mask all the time,
Yeah.
right?
And
Okay.
Dr. Martell wanted them all to go through the same process for the MMR and Hep A, Hep B, influenza, all of them.
You know, it
Just-
just makes more sense this way.
Mhm.
Doug, does that then become a condition of employment?
It subjects them to discipline.
Okay.
So, we did specifically say for the COVID vaccine, it was a condition of employment, I believe. But,
Yes, I think you did.
mhm.
Well, I liked the changes, and you incorporated some of the things all the things we talked about.
Mhm.
What else in here? Anybody have any concerns about the changes? Pat, I always trust you.
Yeah, no, I really liked it because we have eliminated now the places where it said recommends, like requiring some things and recommending other things, and we just made it uniform across the whole. It just makes so much sense to me.
Agreed.
Yeah,
Mhm.
What about the appeal process? Everybody happy with that?
Mhm.
Yeah.
And then I added in a section that once they finish whatever process, wherever they stop, they have to get vaccinated within 30 days if they're not approved.
Yeah, I think it's reasonable. Yeah.
Yeah,
And I know we left it up in the air, but I like the idea of going from the personnel committee to the full board.
Mhm.
I
Oh,
know
yeah.
it may be cumbersome, but I think that's probably the most independent group you're going to get to look at a denial of an exemption. It's across the board. I mean, we got so many different kinds of people on there and different expertise. And I just wish we had that second doctor slot filled right now.
Yeah.
That bothers me. I mean, it bothers me more than filling in somebody like me or Bob. That doctor slot, I think, is important. I miss Steve. I guess I'm saying I miss Steve.
Yeah.
And I think Dr. Martell is working on that, so.
Okay, yeah. Steve just brought so much, just like Pat and Lucy. I mean, they brought so much experience and knowledge and background. And I just miss Steve in the worst way. And so that means Pat and Lucy, you cannot leave.
Oh, really?
Yeah, you can't leave until I leave. Then you
I'm
can leave.
pretty sure my term was up last year, but
My term was up 2 or 3 years ago.
Yeah.
So
I expect to hear from the county one of these days.
Huh.
I don't
We'll have to look
expect to
at
hear anything other than do you own anything that's going to be the financial
Oh,
disclosure? That's the only thing I ever get from the county is the financial disclosure.
Yep.
Mhm.
But none of us should even be on the board anymore because we've never been reappointed.
Well, you serve until your successor is appointed.
That's right. That's what I thought.
Just
And
never
Steve
get a
Woodball should
successor.
still be here.
Yeah, watch when they figure it out, we'll all be gone.
Yeah.
All right, so I need some type of motion.
I'll move approval of the vaccine policy. Charlotte, do you want me to say in the motion with the additional, or is your editorial stuff so small that we don't really need to
Yeah,
mention?
it doesn't change the substance of the policy at all, so it's
I'm
like
happy-
changing
all right.
like 2 words, so.
I'll move approval of the vaccination policy for interns, employees, interns, students, volunteers, and contractors.
I'll second.
Okay, any further discussion? Since as we want to do all the time, we've discussed it already before we had the motion. So all those in favor of the motion, opposed, abstain. All right, that's 2 policies. We passed one at the committee meeting
Mhm.
that we already had, and now we got this one passed. And now the third one is the COVID-19 mitigations for individuals working for the Winnebago County Health Department. Now, I should have caught this before, but that caption policy doesn't fit because I don't work for the health department.
Yeah, agreed.
So I think we need to amend in some way the caption for the policy.
Should it be like the other one?
Well, the other one doesn't cover us.
No, that's true.
So it's got to say something else.
Unless
How
we just
about
pull it,
involved with the Winnebago County Health Department?
or do we
It
need to
covers a
even,
lot of ground.
Yeah, I know.
do we need to
Should we
even go
just-
into that? Can we just say COVID-19 mitigation policy and then
Yeah,
let the
Yeah, I
policy?
like that
Yeah.
better. Yeah,
I do
that's
too.
better. So
sometimes we say too much.
Yeah,
yes, we get ourselves in trouble. As Charlotte knows, you never say more than you have to.
Okay.
okay, so we'll revise the name, COVID-19 mitigation policy.
Okay, and what about your thoughts on the contents now?
Oh, do you want me to make a motion so that we're
Yeah,
like
sure,
doing
if
that
you-
really good?
Absolutely. Sure, let's do it. Let's do it the right way and it'll probably mess us up, but go ahead.
I'll move that we recommend this policy. We recommend approval of this policy to the Board of Health.
I'll second.
All right, now discussion.
All right.
Do you want me to say anything?
You got something you want to say? Go ahead.
Yeah.
So one of the concerns I know, Ron, you had raised was the term Winnebago County or WCHD individuals. So in the policy section, it's all individuals in affected areas, which are everyone listed above. It says affected areas. So I just put in quotes, WCHD individuals, so we know it applies to everyone.
Mhm.
try to address that. And then as far as failing to adhere to the policy, we added a section just that either they'll be subject to discipline if they're employees basically, or exclusion from the premises or any activity.
Okay, so we wouldn't be thrown off the board. We just couldn't show up.
Right.
Okay,
You'd have to participate by remotely.
Yeah.
Yeah.
That's if we ever get off of Zoom.
Yeah, well, it could be not in your or my lifetime, but
Yeah.
Well, I don't know about you, Pat, but my lifetime could end today or tomorrow. It's every day is dicey, so, but you're right.
yeah.
Just as an aside, I have a small group Bible study and we have not met in person since February of last year.
Mhm.
And we can't get together because we meet at the Y and they're closed on Sundays still.
Oh, my goodness.
I mean, the Y that we use is the
Yeah.
one at Newburgh and Perryville.
Mhm.
And that's where we met. So we're stuck on Zoom for, I don't know how long.
Can you not find another spot?
It's kind of hard. I'm not going to pay for a spot. So
Well, yeah.
I'm paying for Zoom as it is. I'm not going to pay for a spot. And as to get a spot that would allow us to come in, I tried to find someplace else. The Y has been great.
Mhm.
And I could move it to my church, but it's not a good location for everybody that's in the study. So
Yeah. Well,
we're kind of stuck.
grace shall also come by Zoom.
Yes, absolutely. So look out, we got the boss here.
I thought this really fit the pieces we were concerned about very well.
And Dr. Martell, we're talking about the mitigation policy now. They already went through the vaccination policy and they're good with it, unless you had any changes.
No.
We're good with the vaccination policy with the minor adjustment Charlotte's going to make to the language.
Mhm. I just use declination of the flu vaccine instead of exemption. So I just need to make some
Change that over.
adjustments. Yeah. So
And on the COVID mitigation policy, we're changing the name of the policy
Mhm.
because the board members are not working for the department.
Sounds like a plan.
So, I mean, just so it makes sense when you look at it and then you start reading it, it doesn't make sense as far as the title. Anything else on the contents?
No,
I think so.
looks
No,
good.
I think it's good myself.
Mhm.
I mean, there's a lot here. I trust Charlotte, though. I
I
trust
think it's clear.
Charlotte and Sandra.
Yeah.
The rest of you, I'm not sure of.
If I try to get 3 PCR tests in a week, will I get my results back? I haven't had a lot of tests. I had one test recently where I had a potential exposure, and I did have my results by the next day. But I was just wondering, how are they coming in that fast?
They have been, Pat. I think that might change. But at the same time, we're starting to see a little bit of decrease in infections. I mean, that's, hopefully we'd get down to twice a week. But
Yeah.
so if you need a Monday test, you're probably testing on Saturday.
Mhm.
If and then for your Wednesday, you're testing Monday. So you would have it. So you're actually got Monday through Tuesday, right? So
Yeah. Yeah. Okay.
you're really trying to get out to the, again, 48 hours. But the reason why it's so frequent when the infection rate is so high is because when you think about that most infectious period is that 48 hours before and the 48 hours after you. So when you've got someone who is, for the most part, we're going to say asymptomatic, let's talk about, they didn't have symptoms, they came to the work site. They're unvaccinated. You want to get them as quickly as possible when you've got high transmission. As time goes on, you've got a little bit more leeway time when infection rates go down. So that's kind of the thinking, on that 48 hours. Now, if they go and get a test, they have a receipt that they were tested and they don't have the results, it defeats the purpose, but at the same time, they'd be compliant with the policy.
Requirement. Okay. That did occur to me. Okay.
Who pays for the testing?
The employee, it says.
Well,
Okay, I missed that. Yeah. Is
most
it?
of it's, Ron, if you can choose. So let's say I decide I'm not going to do it till Sunday night and I want to have it for Monday morning, I might have to go to a physician's immediate care and pay out of pocket. But if I'm planning it and I'm part of the regular routine, and I should be able to go to a site that there is no charge.
Okay.
Yeah. And I have to say, the last time I did it, it was a Saturday test and I had the results on Sunday morning. So it was free. So.
Yeah, but it requires someone to plan ahead, and if you don't, then you decide, you may decide I'm not going to do it till Sunday night or for Monday, or Tuesday night for Wednesday, whatever that is. And so then you might have to decide you want to spend the money for that to be in compliance with the policy.
How much does it cost?
It varies, Ron,
Depending on where you go.
depending on where you go. I mean, we hear that I think Physicians Immediate Care was like $170 for their immediate test platform. But interestingly enough, I mean, I don't know if you had a chance to read what Mercy Health System is doing. So Mercy is taking a little bit of a different stance. And I think, and Dr. Dorsey went through it because, you hear, well, they're not requiring. Well, yes, they are. Here's what, if you're going to go through either an exemption, so you're not only, is it just the testing, but you're put into a high risk pool for insurance. And you're required to pay based on your salary, will be paying a certain additional fee on your insurance.
Oh. So they're doing regular testing and something else along with.
Yeah, we asked him that about today. I think they're going to maybe get, in terms of, because again, you have the testing is to protect your healthcare environment, your patients, right?
Yeah.
And then you've got this other piece which says, well, I'm not really requiring them to get vaccinated, but if you don't want to be vaccinated, you're going to test, and you're also going to then go into a higher risk insurance pool. And each hospital is kind of struggling. I'm going to say each healthcare system is struggling with, because everyone's afraid their employees are going to go, and everyone's going to say, well, where are they going to go? I mean, if everyone requires it some way or another, whether you call it a mandate or you call it this or that, you have to decide what you're going to opt for. I mean, OSF was one of the first to roll out, and they had a different deadline. And so, they said, yeah, we've had a few, but, they can't determine, they have not seen a significant change from their normal and routine turnover.
That's good.
Yeah. But, we already had high turnover. So,
Yeah.
I mean,
well, I think it's been
great.
a tough,
But each
year and a
system is
half.
kind of approaching it somewhat differently. So we'll see. Yeah. So the whole cost of testing versus some of the systems are providing the testing at no charge, Ron. But then others, like, you have to pay the higher insurance premium. So.
In OSF, they're not charging you the higher insurance?
Not at this time.
Okay. So anybody at Mercy that's upset should apply at OSF?
I didn't say that.
I thought OSF said you had to be vaccinated unless you have
or you'll be
exception.
terminated. Yeah.
You'll be terminated. So you're
Yeah.
not
All
going
right,
to be able
forget
to go.
that.
And Sweets has the same policy, don't they?
Correct.
Mhm.
Yeah. So, I mean, they all have a policy that
Yeah.
basically requires vaccination. And there's some kind of, I'm going to say disincentive would be the polite word to say it, to, not get,
Mhm. And do those, the policies, well, and the federal government came out with that mandate also about healthcare settings and the need to be vaccinated or have regular testing or something like that. Do those apply to outpatient? I'm thinking
Yeah,
of
anyone who receives, and how the federal government is, how do I say it, leveraging
Mhm.
is if you receive Medicare or Medicaid funds.
Okay, so if you take patients who have coverage from those areas, you have to follow that policy.
Now, and I know he mandated that question. I mean, I know, Charlotte, there's been more discussion about if it's a concierge medicine that doesn't take any insurance or any Medicare or Medicaid, arguably, they might not have to be complicit with this. Yeah, although the executive or, it's,
Mhm. But there really wouldn't be almost anybody else, would there?
well, and then they'd have the other thing, they'd still be required, depending on how many employees they have, under OSHA be required,
Right.
there are multiple pivot points on it,
Mhm.
is my point, kind of like there might be very rare circumstances under which
Mhm.
a healthcare setting, and I'm going to say a healthcare practice, but let's get down to practice because it's not going to be a setting, would not have to comply.
Okay. Okay,
Anything else?
we could vote.
Okay, so all those in favor of the mitigation for, what do we change it to?
Just
Just the COVID-19
COVID-19
mitigation?
Mitigation.
mitigation policy. Mhm.
All right, good. All those in favor of approving this for recommendation to the board?
Aye.
Opposed? Abstaining? All right.
Good.
I've got a couple questions, or a suggestion and a question. This came up, I've gotten confused responses from people that may not even know what they're talking about, but the latest indoor masking requirement from the governor, does it or does it not apply to houses of worship?
Does
It
not.
doesn't.
It does not.
See, now, I've got a whole Northern Illinois district of my denomination who thinks it does. Contrary to what it was in the past, they thought it was now applying to them. And I think they just found out that may not be true, even though they all went to masks, most of them all went to masks inside because
Well,
they
good for
thought it
them.
applied. Well, once they find out, it's not, it's going to be all over the place.
I think the Department of Commerce and Economic Opportunity has issued FAQs and said it does not apply to houses of worship.
Okay.
So it's up
Second
to the
thing-
individual
Catholic diocese.
individual church, huh?
Excuse me, the Catholic diocese, the bishop has instituted that it is a requirement.
Yeah.
Well, they can do that individually.
Thought,
Yeah.
Right. And so, when people have asked, Ron, I will say to them, certainly it's an indoor recommendation. Now, if you're having a small group, everyone's vaccinated. For instance, I'm going to say a Bible study or something like that, where everybody knows, and basically they're in a pod, they're in their own little bubble. That's a different scenario. But when you're talking about those larger worship services where people are, you're not able to maintain social distancing, you don't know the status of everyone. And frankly, the children are not eligible at this point, right? So you have that kind of moderating in that point. That's when you have to really think about where you're seeing different and divergent kind of thoughts on that, right? So if it was a small group as part of a worship service, that was where we saw churches say, that, indoor setting, they could maintain 6 feet apart. Everybody was vaccinated. It was a small group. It was essentially a small group. Then, that's where the faith-based, but what they would not do is obviously anything like they did this before. No, I'm going to say shut down or, no allowing for services. So, that clearly is not going to be so you do not have to, but we would always encourage best practices. And most of our bigger organized faiths, I'm going to say bigger churches, are following that guidance because they want to keep their congregations safe and they want to keep them in person, right, as much as possible.
Mhm. Yeah, Bob, did you have something?
No, I just wanted to state what the bishop has ordered for the Catholic faith.
Yeah, in my denomination, there's no ordering. It's everybody for themselves. Each
In
church
our-
makes its
yeah.
own decision.
In my congregation, it was a decision by the church board and the minister
Mhm.
to keep.
That's pretty much what it is. Yeah.
Yeah, and
Good for us.
it was to maintain the Zoom services that we had so that people who didn't want to come in didn't have to, and to use masking for everyone who was there, because we do have in person.
Right. Another question. President Biden's declaration, everybody get vaccinated, said down to age 12. And is it true that the vaccination has only been totally approved down to 16? Now, am I reading that wrong, Charlotte or Sandra? I thought there was a discrepancy in the ages as far
Yes,
as
there is between the full authorization versus the emergency use authorization. But his
Right.
overall recommendation is that everyone over the age of 12 be vaccinated.
So how do we get to that when we don't have full authorization down to 12?
Because we've had a vaccine under emergency use authorization as we've had up from 12 and above. So I
Okay.
believe it was 18 on the full authorization. I'll have to go back. It was only on the Pfizer product, right? So it wasn't on Moderna or on the Janssen.
Right. I think a lot of places have been waiting for the FDA to approve it, to make it mandatory, but that's not necessarily tied together.
Okay. As far as boosters, are we up in the air? It's supposed to be what, over 65
Okay,
and those
And you're
with,
right, it's 16 years of age and older on the full authorization. Just wanted to
Yeah.
double check on that. And yes, they are still okay, so the FDA looks at the data and the science and makes some recommendation. Then the ACIP, which is it's really the Advisory Committee on Immunization Practices from the CDC, looks at it. And there was some discussion, but no vote on whether or not individuals 65 and older without would receive booster doses. So
okay.
there's more to come, as they say. And again, they only looked at the data from Pfizer, not Moderna or Janssen.
So for Pfizer, if they're under 65, but they're immunocompromised, they can get the booster?
No, it's not a booster. They get a
Or
third
the shot, yeah, the third shot, yeah.
Right, they get a third dose. And so what's going to be challenging on that, Lucy, is that the third dose, it just has to be 28 days after the second shot, right, or the second vaccination in the
Okay.
series. A booster will probably have a longer time frame associated with it.
So with
Because
the third shot, because somebody had asked me, and how do they know if they can go in and do it? They had both shots through the health department.
And so, do they have an immunocompromised situation?
Well, yeah, she's got a kidney issue, and she's also taking care of her 105-year-old grandmother.
No, the 105-year-old grandmother doesn't count.
That doesn't matter.
I mean, I hate
Okay.
to say that, right?
Yeah,
It's her own
I think she counts for
immunocompromised
herself.
condition.
yeah.
And so if her response to that she had conditions that were immunocompromised, it would have already invited her to come in for the third dose.
Okay,
If she thinks that she didn't respond to that question, she can still go on our website and redo those questions. And if
Okay.
she's eligible, they'll offer her the third dose. We are not authorized to use those federal assets for which, I can't just say, yeah, it makes sense. She's got a 105-year-old and she's got a kidney. I'm going to go ahead and get it, give it. I have to follow what is been allowed for me.
right.
Yeah.
Okay, I'll pass that on to her, and she can go on the website and,
Right, and she can update her medical history, and
Okay.
and if she's eligible, they'll send her an invite for the third dose. Yeah, and that's why we're very careful about calling it a third dose versus a booster. So third dose means they don't think their immune system got a full response from the 2-dose series, so they need a 3-dose series. A booster indicates that your immune system achieved full response, but then has waned over time. And so it's gotten less, effective. And so that's why they're making this distinction between a booster and a third dose. But if you're counting, it all adds to 3, right?
right. So if they get approved, then do they just call and set up a time? If
No,
they get approved?
they'll actually be, so let's say she goes in and she updates her information and it will send her an invite to schedule an appointment. If
Okay,
she's not eligible, it
She
will
won't
say
get it.
thank you, right?
okay, perfect, thank you.
Following up on the booster thing, is there a cutoff where they think, boy, you really need it? And do they base that on your antibodies test
No,
I
no,
mean,
no.
I just had blood tests at my doctor,
Uh-huh.
and I never had the virus according to her test, whatever the test was, and that my antibodies have dropped and my wife's has dropped to a certain number. Is there a number that everybody's interested in?
No, because they call it, how does it, neutralizing antibody production. So that's why it's not just something you run in the doctor's office tests, right? That's the challenge has been on this. People have said, well, I don't show any antibodies. First of all, the stabilization on those tests, they have not standardized as much for the clinical trials. What they do is actually go in and see, can this virus, or, can your antibodies neutralize a virus? So they take basically your blood cells and put it with the virus, and, they have the neutralizing antibody effect. They don't just draw blood levels, right? So that's where some of this information has been out there. And they also look at clinical pictures. So, you heard me say that chances are anyone 65 and older may be eligible for a booster. They're going to consider that as part of the ACIP guidelines. And as anyone in a congregate care setting, right? Because we've seen that number tick up. So what they did not have is sufficient data to say everybody should get it. So that came up with then who should, and they have not made that decision. Now, remember too, most of the data that they looked at was from Israel, and Israel's about, almost 90 days ahead of us in data, right? They started vaccinations early, they achieved higher levels. And so, again, it's not never, it's just not today. I always say that they'll probably in another month or so, they'll say, oh, wow, we should, we're going to start with boosters again. But I think that we'll continue to watch the committees and what they decide and how they determine. It could be the first cut is over 70. It could be over, certain ages that they'll do, or certain living situations. And that's only for Pfizer. We haven't heard anything out yet on Moderna or with the Janssen product. So more to come, but I know the president was ambitious when they said, we were supposed to start it today, right? September 20th. Yeah. But I think that it's, again, important to understand they are making sure they're making science-based decisions regardless of all the offices that are held by whomever, and, kind of working that through about what's going to happen, who needs it. And even with the waning in effectiveness of some of the vaccines are above 70s, upper 70s, according to a lot of the data that's out there. So it's not that your vaccine's not effective. It's just not at the 95 level, maybe that it was when you first got vaccinated. So why we wear the face coverings with people we don't know. And, we're starting to see a little bit, I'm feeling a little more optimistic that, it seems to have a life cycle. And if you read the New York Times, you probably read a little bit on the blurbs. It seems to go through a 2-month life cycle on the variant, kind of burns up, burns down. But we seem to be in a little bit the numbers are starting to come down a little bit, which bodes well. We got everybody, the kids are back in school. There's a lot of work going around that. I think probably we're also going to see approval of that vaccine for younger children. And I'm going to say that it looks like the 11 to 5-year-olds first, possibly someone said by Halloween. So, okay. But they get a smaller dose, Ron. See, they have to test it. Not only do they have to find out, do they have the same immune response, but how much dose is, enough, sufficient, and how much do you control for the side effects? So, more to come on all of this. So stay tuned. We will, though, administer your flu vaccines. We are getting ready for gearing for that. We typically want to see those probably for your October. I want them a little bit later than years past because of the predictability on this is October, but it won't matter. Let's say we give it to you October 1 and October 2nd, they approve a booster. You do not have to wait then 2 weeks or whatever for your booster doses. So that is what the data is also coming out. That has shown we can give it concurrently. You do not need a minimum separation time between really any of the vaccines and COVID-19.
That's good to know.
Yeah, so I don't want anyone to hold the flu shot thinking I'm going to wait for a booster on the COVID. That's what my point of that whole long story was. Don't wait.
Yeah.
Sandra,
We'll schedule
Bob?
new appointments to come in.
yeah, I have a question. Where does the flu vaccine fall in with all this right now? We're in the season now for, in the past, the flu vaccine has been.
We are starting to vaccinate. We have our first, I'm going to say, combined COVID and flu is in Durand tomorrow. And then we're starting our process of offering it. Part of it for all state of Illinois employees, we were required to offer it. So you'll be looking at that agreement. So we have to offer both. You can pick one, two, or none, but again, that's, and then we will also be doing our flu clinics for our Board of Health as well. So we will make sure that you have opportunities to get vaccinated, and we'll be in October.
Okay, thanks.
I'm going to probably think that if we're not doing live meetings yet, but if evenings are better, we'll figure out usually, if Tuesday night seems to be when you hold on the calendar as a time to come in, then we'll kind of try and keep it together on a night that's familiar to you.
Okay, sounds good.
And last thing for me, I'm
Question.
sorry, go ahead, Pat.
Can I do one more question really fast?
Sure.
Sure.
The updates the COVID updates that Katie sends out to us, there's a long list of people who get that. Am I fair to assume that that is for public information?
Yes.
Okay, so I would be able to forward that to my two friends who keep asking me these same questions and never go to the health department website. And so I'm just thinking about a way to say
it is the liaison officer per report, right? That comes out on Fridays.
that's the one I'm talking about.
And
Yep.
so typically I would only ask that you probably wait till the next day, right? Then send it
sure.
to your friends, and because all the elected officials get that, right? Because, and of course that doesn't mean they all read it. They just get
No.
it, right? And then we review it.
Mhm.
But the idea being that we want you to have the information that's been going on through the week, and anything that's new that you can share out, right? I mean,
Okay.
we actually prepare some of it. I think you could actually post on if you do social media, you could do that.
Well, it's good to hear since I've been doing that.
Hey,
It wasn't positive, and I just wanted to
no,
mention.
we would tell you if, first of all, we would keep that, for official use only, not for distribution. We'd put all those disclaimers on it, but the idea being that people should ask you, you're the Board of Health. They run into you in the store, or their friends,
yeah.
neighbors, family members,
They do.
Last thing for me is a suggestion for you to keep in mind to send out a digital version of all our policies at one point. So we have those, because I know over the years I've worked on policies, we've had policies, and I hate to tell you, but I don't keep all that paper. So at some point, get all the board members, all the policies so they could refer to them. And also the organizational documents. And I think we also have bylaws, if I remember correctly from before. And that way we will have in front of us, if we need it, what the requirements are for the board members. We think it's one thing. And I remember when we looked into this, it's not exactly what we think it is. It doesn't necessarily require all the people we think it requires. And so it would be good to have that. It would probably be good for the nominating committee to know that too, whatever they're working on. But just at some point, I know we're changing policies and we're updating policies, but to get all that on. When I first started, I got this folder that was like this from Mike Bacon. It had so much stuff in it, and you could, it was incredible. Well, after 10 years, it's all out of date and doesn't mean anything anymore. And I don't even have that stuff. So we could get a digital copy of all that, so we wouldn't have to pick up a shelf, but could have it on our computers and could refer to it at some point.
That'd be very good.
Yeah.
Yeah, we just kind of started revising the new board orientation. So that, and I know Charlotte's revising some of our policies, so we'll put them all together. You're right, because I had the same issue. Christina laughs. I'll say, where was that last filed?
Yeah.
Move my cheese.
Yeah, and that's one thing I wanted to work on anyways, is just getting all the policies in one place for not only for you guys, but for the employees. They're on the
Yeah.
stamp right now,
Yeah.
but it's hard to figure out which ones. And so I think we need a more organized way to handle them. So yeah, definitely.
Always a challenge.
I'm sorry, I forgot one more thing. I did get the FOIA request Friday, and I sent you, so you're okay? You don't need the originals? I sent you copies. I'm sure it's the same as you've seen. Okay. I turned over all my records, so
Okay.
I
I didn't
know.
have any, but I would turn them over if I had them, but I don't have them. So that's why you don't keep anything.
Yeah, I came home from that, the last Wednesday meeting and I had 5 of them at my house. So there you go.
Okay.
No, I
Yeah.
want to know, I mean, they did not require me to sign for mine. They just showed up at my mailbox.
Wow. No, I had to sign.
I didn't get anything yet.
Which is just
Not
fine.
one of those.
So you all feel left out? Is that it? Or,
No, that's quite all right.
okay. All right. I'm assuming we don't need an executive session.
No, we did not.
Okay. And there's nothing else that we need. Okay. Is there a motion to adjourn?
So moved. Okay, second.
All those in favor?
Aye.
Opposed? I guess we'll see we'll see everybody
All
tomorrow.
right.
Just thanks, everyone. I know we had to pull this together at the last minute for consideration. We do appreciate it.
Okay.
No,
Thank you.
Bye.
absolutely. Thank you.